Foster Care Nurses Training, Killeen ISD. HARP Awareness. The federal law of McKinney-Vento Homeless Assistance Act indicates that most students live in a fixed, adequate, and regular nighttime residence. Fixed is defined as stationary, permanent, and not subject to change. Adequate is meeting both physical and psychological needs typically met in in-home environments. Regular is on a predictable, routine, and consistent basis. The McKinney-Vento Homeless Assistance Act defines homelessness for children and youth as lacking a fixed, adequate, and regular nighttime residence. This would come in the example of sharing housing with others due to economic hardship or similar reasons due to lack of alternative adequate accommodations, living in motels, hotels, camping grounds, etc. due to inadequate alternative accommodations, living in emergency or transitional shelters, living in public or private places not designed to be lived in by humans, like cars, parks, abandoned buildings, substandard housing, buses, or train stations. Killeen ISD has a large number of HARP students also because of the military base. So students who are living with extended family or family friends because one or both parents are deployed can also be considered a HARP qualifier. Students experiencing homelessness are entitled to immediate enrollment, school of origin or school of attendance, free meals, school of origin transportation, additional educational supports. Homeless students are to enroll even if they do not have school records, proof of residency, guardianship papers, birth certificates, medical records, immunization records. For safety reasons, the school can ask for an address and phone number, but not proof of residency. If the school of attendance is based on the child's current address, the school of origin is the school the child attended when they were last permanently housed, or the last school the child was enrolled. If a child attends the school of origin, which is outside of the child's school of attendance, the school district will provide transportation to the school of origin. These are some additional supportive items provided to students. What is essential for clinic staff here are vouchers for immunizations and sports physicals can be provided from the clinic staff, the nurses, so that they can receive immunizations and sports physicals free of charge. There's also additional items or resources provided to them. Just make sure you're communicating with your campus liaison if the child or parent are asking you for community resources or resources within Killeen ISD. The Texas Vaccines for Children program was created in the 90s. It basically ensures that children receive immunizations free of charge from birth to 18 years old if they meet certain eligibility requirements. And that can be found on the Texas Health and Human Services website. Just a Texas fact here. Texas has the largest population of under or uninsured children in the nation. We lead the statistics with 3 million children who are under or uninsured. And on Medicaid, so that is considered underinsured. Some information for parents that can be found on the Texas Health and Human Services website as well. So specific to their race or ethnic group, specific to their economic status, and Medicaid status. These are different locations that children can receive vaccines in our community across Killeen, Nolanville, Coppers Cove, and on post. If a family is asking for how to find a provider, of course, you're going to supply them with the local health department vaccine dates. It is important to know that if they go to the Bell County Health Department, they must be there around 6:45 in the morning, if not earlier, and they only take the first 25 patients every Tuesday to supply vaccines. And we do not want to utilize this resource for their vaccine translation services as much because they require an appointment to translate vaccines, and we can utilize Google or other services to translate the vaccines ourselves rather than take up an appointment that could have been used for someone who actually needs vaccines. And all childhood immunizations are offered at the health department and all the pediatric clinics. If you need to request an immunization voucher, please email harp@killeenisd.org in the subject line shots. The body of the email must include the student's full name, their student ID number, the campus they're attending, and what immunizations are needed. Here's an example. Instructions for you. So you will print out the voucher in color, make a copy of the student's shot record, and that can be from eSchool, that's fine, or MTRAC. If applicable, type a statement and sign it explaining the student has no immunization record and is starting over if that is the case. Ensure parents and guardian gets the voucher, shot records, or the signed statement. Keep a log of all contact with the parent, documenting efforts to get immunizations, include date, time, and type of contact. Ensure that the parent or guardian has had a voucher for at least 2 weeks prior to contacting the HARP counselor regarding exclusions. No exclusions of a HARP student for lack of immunizations unless prior written approval has been given by the district homeless liaison, Christiane Shin. Parents or guardians will take the voucher, shot record, or signed statement and a photo ID to Freedom Urgent Care. Bring updated shot records to the school nurse. Before excluding a HARP student from school, email harp@killeenisd.org. Subject line, shots. Include all documentation, which is inclusive of the contact documentation you have tracked. The HARP counselor will review the data, forward to the district homeless liaison, and contact the parent. The district homeless liaison and HARP counselor will work with the school and parent on the specific exclusion date. If you need to request a physical voucher, the steps are very similar. Please see here. Physical voucher instructions, similar. Please follow all the steps. Clinics where students can receive a physical: Greater Clean Community Clinic, the Texas Department of State Health Services. This one's in Coppers Cove, but is by appointment only. I will have to confirm that this contact information is up to date, but as far as I know, it is current. Foster care awareness. Students in foster care are in the managing conservatorship of the Department of Family Protective Services and are entitled to immediate enrollment, school of origin, free meals, school of origin transportation, and immediate enrollment. Foster care children are to enroll even if they do not have school records, birth certificate, medical records, immunization records. However, the Department of Family Protective Services has 30 days to provide the missing documents. Foster parents should have the green binder. Additional information regarding foster care awareness. Please reach out to the foster care team for the school district if you have further questions. Thank you.